Yeah, hi. One more. Good day, good morning, good afternoon, wherever you are. Welcome to my channel. My name is Dr. WAN, and I'm here today to talk about diabetes, precisely type 2. Essentially, what is it? What can be done to bring it back to normal? Exercises involve activity and all what you need to know about diabetes management. If the time permits me, I will also include pharma. So I will start first of all with non-pharma and also physical activity. The video is going to be longer, so just be patient and listen to it keenly. First of all, there are various types of diabetes, so I don't want to make this video too long, otherwise it can be boring to those who are listening or following me up. So I will rather pay more attention on type 2 diabetes. Type 2 diabetes is a disease in which your body glucose or blood sugar levels are too high. Glucose is your main source of energy. It comes from the foods you eat. A hormone called insulin helps the glucose get into your cells to give them energy. If you have diabetes, your body does not make enough insulin or doesn't use the insulin well. The glucose here then stays in your blood and not enough goes into the cell. So this is a panoramic view of type 2 diabetes. So we are going to look for a solution to all these defects that I've just read. That is, why should your blood sugar spike? It means there's something wrong. So it could either be insufficient supply of insulin or the muscles are not really stimulated to absorb this blood sugar building in the blood. So there are a lot of things going here, and the good news is we are able to solve this problem. You don't really need to go far away. You yourself, within your comfort zone, can resolve this issue. And that's why I'm making this video for you. So the insulin, that one for sure, there may be some issue at the level of your pancreas. So that's where trouble is coming in. Say, for instance, you might be on some medication that they irritate the pancreas. For instance, medication for HIV, they easily irritate the pancreas. Medication for cancer, they do irritate the pancreas as well. So we term those one drug-induced diabetes, just like your lifestyle. So over time, having too much glucose in your blood can cause health problems. But you can take steps to manage your diabetes and try to prevent these health problems. What causes type 2 diabetes? That's the big question. And it's quite simple, like I said in the beginning. Type 2 diabetes may be caused by a combination of factors. So the first one is being overweight or having obesity. So here, please, you need to be careful here. I remember I did lecture all this in one of my videos, which you have to go back and check. So obesity, meaning that you put on so much weight that the tissues around the pancreas they all become engulfed. So the pancreas now is not able to supply enough insulin. So that is the whole issue here. Overweight also is the same thing. So you make sure you measure your hip to waist ratio. That one is very important, and you need to make sure that you are under 1, because if it's over 1, that's already a big red flag. You can go back on my YouTube channel and see that particular video that I made for that purpose. Another one is not being physically active. So not being physically active here is a big issue. Now, what do I mean? You essentially need to go out of the house and walk for 30 minutes. Be careful here. For all those who are diabetic, they don't really need to engage themselves in marathon. No, because marathon is risky. You risk finding yourself in hypocondition. So the recommended time for you to engage yourself in exercise is 30 minutes, your max. I would suggest you do a series of 30 minutes. Say every 2 hours you do 1 30 minutes exercise, and that's it. You might do it, say, 5 times a day. Why not? The more you do it, the better for you. So that's what I'm saying. I know people will tell me, oh, here in North America, there's snow outside, so I can't go out of the house. Okay, then that's fine. I will suggest for you another option. And I'm going to make it even quite interesting by singing a famous song that we were hearing this song when we were children. You can even stay indoor and sing that song, and it is actually therapeutic. It has been proven. So we will come to that. Another aspect here is genetics and family history. So those are the 3 points that leads to type 2 diabetes. Now, type 2 diabetes usually starts with insulin resistance, so meaning that you put on so much weight. This is a condition in which your cells don't respond normally to insulin. As a result, your body needs more insulin to help the glucose enter your cell. At first, your body makes more insulin to try to get cells to respond. But over time, your body can't make enough insulin and your blood glucose level rise. Now, who is at risk of type 2 diabetes? You are at risk of type 2 diabetes if you are over 45. Children, teenagers, and younger adults can get type 2 diabetes, but it is more common in middle-aged and older people. Have pre-diabetes, which means that your blood sugar is higher than normal, but not enough to be called diabetes. Had diabetes in pregnancy or give birth to a baby weighing 9 pounds. I've said this one also in another video, that when you deliver or when you are pregnant, that child's weight is also being monitored. So that's a big issue here. So 9 pounds, or I would say 4 kilos. That's another thing. Have a history of diabetes, are overweight or have obesity, are Black or African American, Hispanic, Latino, American Indian, Asian American, or Pacific Islander, are not physically active. That's another one which I said before. Have other conditions such as high blood pressure, heart disease, stroke, polycystic ovarian syndrome, which I made a video for that purposely. Depressed is another one. So all these things, we will handle them with one magic song. The song that you can't believe it, but it is therapeutic. We will handle this depression story because it impacts your life as a diabetic patient. Have low HDL, that's the good cholesterol, and high triglycerides. So you see now, when your cholesterol value, the good one, is low, you are at risk of developing type 2 diabetes. Another factor is having acanthosis nigricans. That is kind of a dark, thick, and velvety skin around your neck or your armpit. So if you look at some women around their neck, it's kind of something like a line or a ring, a dark one around their neck, or the dark armpit. Those are all some of the factors that you need to look into it. Now, what are the symptoms of type 2 diabetes? I made a video for this one to explain what it is. So I just need to rush here faster. Many people with type 2 diabetes have no symptoms at all. If you do have them, the symptoms develop slowly or over several years. They might be so mild that you do not notice them. The symptoms can include increased thirst and urination, increased hunger, feeling tired, blurred vision, numbness or tingling on the feet or hand, sore that do not heal, unexplained weight loss. So I just rushed over this one. There's a video for that also on my channel that you can see. So there's no point wasting so much time here talking about it. How is type 2 diabetes diagnosed? Which this one also, I made a video for this and you will find it on my YouTube channel. So essentially, you need to do the test called HbA1c, which measures your average blood sugar level over the past 3 months, fasting plasma glucose, which we call FPG test, which measures your current blood sugar level. You need to fast, not eat or drink anything except water for at least 8 hours before this test. And then random plasma glucose called LPG test, which measures your current blood sugar level. This test is used when you have diabetes symptoms, and that's it. And now we go to the next one. What are the types of treatment for type 2 diabetes, which I just explained to you that there's non-pharma and there is pharma here. So essentially, the treatment for type 2 diabetes involves managing your blood sugar level. Many people are able to do this by living a healthy lifestyle. Some people may also need to take medicine. A healthy lifestyle here includes healthy eating plan and getting regular physical activity. You need to learn how to balance what you eat and drink with physical activity, diabetic medication for those who choose to do so. Medicine for diabetes include oral medicine, insulin, and other injectable, which I actually made a video for that to explain. So please go there and look at it. It's also important to keep your blood pressure and cholesterol level close to target. That's it. So now, I was talking about the types of muscles involved in diabetes because, like I said before, you see inactivity is another big problem with diabetes. So we need to make sure that we engage ourselves in activity by using your hands. Your hands have to be active. Your legs also have to be active. So I'm going to sing a nice song, and you understand now why this song. I know people will tell me, oh, it might sound childish, but again, it's very important. So let's go. If you are happy and you know it, clap your hands. If you are happy and you know it, clap your hands. If you are happy and you know it, then your face will surely show it. If you are happy and you know it, clap your hands. If you are happy and you know it, stomp your feet. If you are happy and you know it, stomp your feet. If you are happy and you know it, then your face will surely show it. If you are happy and you know it, stomp your feet. And I'll add another one for depression. If you are happy and you know it, say amen. If you are happy and you know it, say amen. If you are happy and you know it, then your face will surely show it. If you are happy and you know it, say amen. So you see, this part of saying amen is that quietness of your mind. Because like I said, diabetes comes with depression. So you find it difficult accepting your medical condition. But the moment you are cognizant of what it is, then you can now manage that disease properly. So that's why this song now, I incorporated 3 things here. Your feet, your hands, and your mind. Your mind by saying amen. So let's go now into detail why these particular things. So your hand, which you have to clap, has 4 major muscles. Your upper arm muscles anatomy includes bicep brachii. Your bicep muscle is in the middle of your upper arm. Then you have the brachialis. This deep muscle sits underneath your bicep. Then you have now the coracobrachialis. Also deep under your bicep. This muscle connects to your scapula, shoulder blade. And then you have now the tricep brachii. So those 4 muscles are very important when you are singing that song. So if you think you cannot go outside to walk, then within your bedroom, you sing this song as many times as possible and putting in action, clapping your hands, then you're going to see some changes. It is not miracle, it's something real. Then, coming back to why you have to stomp your feet. So, you see that the thigh has 3 sets of strong muscles. The hamstring muscle in the back of the thigh, the quadricep muscles in the front of the thigh, the adductor muscles on the inside of the thigh. So we have to stimulate this muscle by stomping our feet. So that's the reason why I make you sing that song. So don't think I want to make you put childish. No, there's a purpose for everything I do here. So that's my reason for asking you to sing that song with me. The main muscles group in the legs are quadricep, hamstring, adductor in the upper leg or thigh, and the calves in the lower muscle. Now, let's look into the calves muscle, how they are. The calves muscle is made up of 3 muscles: the gastrocnemius, the soleus, and plantaris. The gastrocnemius is the larger muscles in the middle of the calf that gives it its rounded shape, while the soleus is the flatter, longer muscles underneath. The Achilles tendon connects the calf muscle to the heel bone. Calf muscles help with walking, and that's why I tell you go outside and walk, or you can tiptoe. When you tiptoeing in your own house from bedroom to kitchen, kitchen back to bedroom, or bedroom to parlor, whichever way you are moving within your house, That's what you do by activating these muscles. And when you activate these muscles now, the blood sugar building up in the blood, the sugar now moves to those cells of those muscles that you are activating them. Calves muscles helps with walking, running, jumping, standing on your toes. So you have to tiptoe and flexing your foot. That's why that song I said, stomp your feet, flex them. Calves injury are common in sports that involve running, and they usually occur when the muscles are tired. So in this case now, that's why I said you don't have to run. It's risky for you running. So you just tiptoeing, worst case scenario, brisk walking. Here are some exercises that can help strengthen your calves muscles. Seated calves muscles. While sitting in a bench, raise your heels off the ground by pushing with your calves. So that's what I'm saying. So you must do this one also, seated calves raise. Calves raises, stand with your feet shoulder width apart and raise up onto your toe. That's another one. Skipping rope, which is quite interesting. I used to do this one when I was a child. Start with shorter interval and gradually increase the duration. And the next one is box jump. Stand in front of a box or platform and jump up onto it. So these are the things that you have to do, and you're gonna see some magic. So that's why I choose to make this video today, to make life interesting for you. And to end it all, we're gonna sing this song again, and you're gonna understand now why this song is important. If you're happy and you know it, clap your hands. If you're happy and you know it, clap your hands. If you're happy and you know it, then your face will surely show it. If you are happy and you know it, clap your hands. If you are happy and you know it, stomp your feet. If you are happy and you know it, stomp your feet. If you are happy and you know it, then your face will surely show it. If you are happy and you know it, stomp your feet. If you are happy and you know it, say amen. If you're happy and you know it, say amen. If you're happy and you know it, then your face will surely show it. If you're happy and you know it, say amen. If you're happy and you know it, do all three. If you're happy and you know it, do all three. If you're happy and you know it, then your face will surely show it. If you're happy and you know it, do all three. So the three things here are clapping your hand, stomping your feet, and saying amen. And that's the miracle. Your blood sugar will definitely go down. Once more, thank you for listening to me. I am Dr. WAN, your brother, your sister, your lecturer, and everything. Thank you and have a wonderful day. Ciao.